Good morning friends. I am Dr. Seema Krishna Mane, founder of SJS Eye Patient Support Group. Today our video is about role of punctal cautery in patients with SJS 10, Stevens-Johnson syndrome, toxic epidermal necrolysis. We know SJS is an irreversible disease. There is hardly any technology or drops available for the regeneration of tears. So what we have left with is just putting those lubricating drops. Whenever we put these lubricating drops, after some time for patients with severe dry eyes where there are hardly any tears left, they will feel immediately dry. Maybe in a 1 minute, 2 minutes, 3 minutes, 5 minutes. It depends upon how much grade of damage has happened during the disease process itself. So when we don't have anything to regenerate, what we can do is just to preserve whatever drops we are putting into the eye. So there comes the role of punctal cautery. After starting this group, I have came into contact with multiple patients throughout the world. I came to know that there is very less awareness about even a basic treatment of Stevens-Johnson syndrome eye diseases. So this is my effort to spread this knowledge as much as possible. So what is this punctal cautery is? There are a puncta, the natural opening in upper and lower eyelids in both the eyes on the nasal side. So what they do, whatever drops we are putting or the natural tears, when we blink the eye, these tears are carried from the lateral side to the medial side through these opening into our mouth or a nose. So when we don't have any tears into our eyes and whatever drops we are putting, they are going directly into the mouth or nose, we are trying to close this puncta with the help of punctal cautery. Cautery is cauterization, like burning those puncta. This is done under the anesthesia, so it is a painless procedure. These puncta are destroyed completely. We know that SJS is an irreversible disease. So whatever we are doing is like kind of a permanent treatment. So once we destroy these puncta with the punctal cautery, then whatever drops are being put into the eyes, they will stay longer on the ocular surface, on your cornea, and the hydration of cornea will be maintained for a longer time, and this in turn will decrease the sensitivity to light, and in many patients even the frequency of drops is reduced. Many of us are using scleral lenses for these SJS eyes. You can use these lenses even for 12 hours, 14 hours, few patients wears even 16 hours. When they remove these lenses, it is very unbearable for them to open the eyes because of the severe dryness. So here comes the role of punctal cautery, because when you are not wearing these lenses, whatever drops you will put into the eyes will stay longer on your cornea, will give a better hydration, and you can at least open your eyes. So these are few advantages of punctal cautery. There is one more post procedure called punctal plugs, where the plugs are put in these puncta. This is a reversible procedure. So when we know that SJS is irreversible disease, there makes hardly any sense to do this reversible procedure in SJS. So mostly punctal cautery is preferred over the punctal plugs. So I hope this video has created little bit awareness among all of you, and it will help you to get to your ophthalmologist to see if this procedure can be done in your eyes. Let your ophthalmologist take the best call for you. He will take the final call for you. Take care, take best care of your eyes, and live this precious life with all positive vibes. Thank you.